Good morning, everyone.
Good morning.
I'm Congresswoman Terri Sewell. I proudly represent Alabama's 7th Congressional District. And of course, one of the crown jewels of the 7th Congressional District is none other than the city of Birmingham. I want to take a point of personal privilege to thank the amazing healthcare professionals right here at Alabama Regional Medical Services. You all were the true heroes and sheroes of the pandemic, and we are forever grateful to your profound sacrifice, both physically and emotionally, in the name of keeping all of us safe. When our most vulnerable Alabamians are in need of care, it is our community health centers who stand in the gap. And for that, we all say thank you. As many of you know, I grew up in this district, so I know what's possible from this district with resources and opportunities. My job every day is to try to make sure that I provide those resources and opportunities. So that's why, as your Congresswoman, I have made it a mission to bring federal dollars back to our district to make our community safer, healthier, and more prosperous. It is for that reason that I am thrilled to announce that with my support, the United States Department of Health and Human Services has awarded $600,000 to Alabama Regional Medical Services, ARMS, right here in Birmingham to expand mental health and substance abuse or substance use services. In this great nation of ours, with so much wealth and abundance, no American should go without access to health care, whether you live in a big city or a small town. That is especially true when you struggle with mental health conditions or substance use. When it comes to mental health and substance use, we are facing a national crisis, not just here in Alabama, but all across this country. We as lawmakers must do all that we can to ensure that our communities have access to the treatments and services they need to overcome mental health and substance use struggles. And that is exactly what this funding will do. This $600,000 in federal funding will be used to expand the capacity here at ARMS to provide high-quality mental health and substance use services to the residents of Birmingham and Jefferson County. This project funding is part of a $240 million investment by the Biden-Harris administration to expand behavioral health services at our nation's community health centers. And it will go a long way to improve the mental health outcomes and to combat opioid epidemic that we're experiencing around this nation. I often say that what we fund is a direct reflection of our values. By providing resources here at ARMS, we are demonstrating our commitment to removing the barriers between residents and quality, affordable health care that they deserve. Without further ado, I'm thrilled to welcome up the CEO, Dr. Greer of ARMS, and I wanted to again say thank you so much for all that you do. I cannot tell you how important community health centers are, especially in our district, where our health outcomes are often disproportionate to the others in our nation. And I know that ARMS closes that gap each and every day, and this is an honor for me to be here today.
Oh my goodness.
Okay.
Thank you. Let me just say this is a happy day for this organization, for Birmingham, for the city of Birmingham. We see the violence that's happening in our community. We see families who are distraught for many reasons. One, because they don't have the resources that they need. With this funding and with your advocacy and your leadership, and thank you so much for your support of federally qualified health centers, families are now going to have opportunity to get the resources that they need to address the trauma that some families have, an individual has. Folks who have addiction issues, we're finally going to have some resources in our community right here in the city of Birmingham to offer our patients, our clients, all of that. So I'm very excited about this opportunity. I appreciate the generosity by the federal government through your office. I've been here just under 2 years as CEO. And meeting Congresswoman Sewell, I see her heart, I see her passion. I flew up to DC with some of my colleagues earlier this year, and we met with a lot of staff. But the one congressperson we met with was this great leader here. Took the time on herself, didn't push her staff on us. She met with us herself. I had the pleasure of meeting that beautiful office of yours up there in DC. We had a great conversation, talk about a lot of things, and one of the things that she said was her commitment, her passion and the role for community health centers to help bridge that gap for folks who don't have the means or the resources, including persons experiencing homelessness. That's why we're here. And this is going to go a long way to address not only what we're doing as a core business, primary care services, but also behavioral health, substance use disorders, addressing all of that. And this community owe a lot of debt to you. I mean that sincerely. One of the
We're
things
only as good as the institutions that we have that's undergirth us.
well, without leadership, without advocacy, and having somebody in D.C. always fighting for you, because it's a fight sometimes in Washington with federally qualified health center funding. And somebody that we always know is in our corner is Congresswoman Sewell, and she's proved that time and time again. I should also share with you, we just found out yesterday from the federal government that our proposal score in applying for these funds, 100.
Woohoo!
Our score was 100.
And you know that I'm fighting to pass the budget for 2025, where I think another $500,000
Yes.
for mental health and substance use will be available to our community, to ARMS.
Yes, that is correct. So we're very happy about that. And the other news on the federal government through advocacy again from the Congresswoman Sewell, we receive another $400,000 for HIV prevention.
Yes.
And another $200,000 for school-based care, healthcare services, behavioral health and primary care. So that's a total of $1.2 million.
We're happy for it.
So thank you very much.
Absolutely.
My
absolutely.
team and I, our board of directors, Dr. Childs, asked me to express our gratitude and thanks to you as well. So thank you very much.
Thank you. I don't know if the press has any questions for us, but you know, as Dr. Greer said, our community is especially concerned about crime and gun violence in our communities. And so often there are troubled people who who are the perpetrators of a lot of that gun violence. And you know, so many go untreated. And so the fact that we acknowledge as a nation that we need to spend more resources on mental health is critically important. I think that when the story is written about this global pandemic, it has had a mental health effect on so many. The isolation, the uncertainty. And so I'm just happy that our community health centers, and when I think about our community health centers, it's ARMS, it's right here that you all do so much of the heavy lifting, and especially in the Birmingham and Jefferson County community. And we don't say enough thank you. So this is a thank you, thank you, thank you.
Do you know what's happening in Birmingham? Download the What's Happening Birmingham app today on Android, iPhone, and iPad for free. Get info on everything you need to know about local news, events, businesses, restaurants, and more. Visit our website, what'shappeningbham.com, or follow us on social media @happeningbham for more information. Download the What's Happening Birmingham app today, your source for everything Birmingham.